A lot of people have got a lot of myths about coronary artery bypass surgery or bypass operation. I am Dr. Rajneesh Malhotra. I am Principal Director and Head of Cardiac Surgery at Max Hospital, Saket. I am going to bust those myths and going to tell you what are the facts about bypass operation. Bypass operation means simply that we are going to bypass the coronary arteries. The blockages in the arteries of the heart, if they are there, we have to bypass that. And for bypassing that, we have to use certain arteries. We use arteries from patient's own chest. We call it as internal mammary artery. We take the arteries from the patient's hand, the radial artery, and these arteries, which are patient's own body material, has got long-term survival, because these arteries are not going to get blocked because they are in situ, they are the live arteries, and these arteries remain patent for patient's lifetime. Whereas if we are talking about angioplasty or stenting, people do get confused what should they do. If we go by the facts that people who require bypass operation, the people who have got diffuse coronary artery disease, people who are diabetic have got smaller coronary artery disease, people have got disease at multiple places, and simply put, if the patient has got blockages in all the three coronary arteries, that is the candidate for a bypass operation rather than having multiple stents. The problem with angioplasty and stenting is that if a person gets multiple stents, then the chances of re-intervention are very high. And another myth about bypass operation is that patients who are diabetic should not have bypass operation done, which is not true. In fact, people who have diabetes should have bypass operation, and that is the recommendation, that is the treatment of choice for these patients who have got diabetes. The treatment of choice is bypass operation or CABG, because these patients have got diffuse coronary artery disease, means multiple arteries are blocked at multiple places. So you touch the area which is healthy, you go and do a grafting at the healthy area. So chances of those arteries remaining and surviving, remaining patent, are much higher for a longer period. So another myth is the diabetic patients would have wound healing problems, which is not the fact, because whenever we are operating diabetic patients, we do take care of all the issues which can happen, and we give insulin and whatever is required for these patients so that these patients do not have wound problems. Another myth about bypass operation is that the younger people do not require bypass operation, which is not right. In fact, younger people are in their productive age group. They are valuable, or they are productive for their families, they are productive for the society. So they have to remain healthy for a longer period. So bypass provides them that solution. Whereas if they go for PTCA, angioplasty or stenting or ballooning, they may have chances of re-intervention. So bypass, if it is being done in a younger person, would remain patent for the next 30-40 years, which gives him a very good quality of life, and he can be disease-free for a longer period. And another fact, that the risk involved in bypass is very high. That is not true. I mean, the fact is, the risk involved in bypass is not even 1%. Person who undergoes a bypass operation as an elective surgery, when we have already planned for bypass operation, the risk is not even 1%, and that is less than 1%. That risk is with any surgery. Even if you undergo a gallbladder hernia or any kind of surgery, that kind of risk is with any surgery. So in an elective situation, bypass does not have risk of even 1%. Another myth is that the patient after bypass becomes invalid, which is not true. Patients after 3 to 4 weeks of bypass operation can join back their work, they can do any kind of activity, they can have a good, happy, healthy family life, they can drive, they can do horse riding, they can go and start playing golf if they are doing, or whatever their activities are, they can do, and they can fly, they can do international flights, they can do whatever they want. They can go back to their office, work, and do any kind of activity which is required. So that also is a myth which is very, very prevalent, that patients will not be able to do normal activities after bypass operation. So in my opinion, bypass is something which is a long-term solution for all the patients who have got coronary artery disease, patients who are diabetics, who have got very strong family history. The coronary artery disease are small, so in these patients, the people require bypass operation. And the last thing about, I would say, people say that females do not require bypass operation, or they do not need it, they do not have coronary artery disease. That is another myth. Females after menopause are as vulnerable for having coronary artery disease as males are, because their protection by estrogen is gone. So they are equally vulnerable, and bypass operation is the treatment of choice for them, because the arteries in the female patients are smaller. And in that situation, if you do bypass and put arterial grafts, they have got a long-term solution for them also. So many people feel that what is the difference between bypass operation and angioplasty or stenting? The major difference between bypass operation and angioplasty and stenting is, in bypass operation, we use grafts or arterial grafts or conduits which we take from the patient's own body. Whereas in angioplasty and stenting, we put artificial stents made from metal, and that we put in the diseased area. Whereas in bypass, we put grafts in a healthier area. The arteries which are beyond the blockages, there we put the grafts. So that is a healthy area, whereas in angioplasty and stenting, we put stents in the diseased area. So their chances of getting reblockages still remain, because the blockages can regrow in the stents and patients can have restenosis. That is one thing which makes people to have reintervention. Whereas the other thing is, a person who has got an acute heart attack, angioplasty and stenting is recommended in that situation. Whereas the person who has got blockages only in one artery, or the eccentric plaque is there in one or two arteries, angioplasty and stenting is recommended in that. But if the person has got blockages in all the three arteries, so bypass operation is the treatment of choice in these patients. Bypass remains a long-term solution for patients who have got coronary artery disease, and that should be recommended. And if the person has got coronary artery disease and he is confused, patients should go back to their physicians, consult them, and take their advice for having some kind of intervention at the earliest. Thank you.